Hi, good evening. Steve Adler. Got a minute? All right, so let's talk about the numbers today. We're going to be focusing more and more of these numbers, I fear, over the next couple weeks. We'll talk about how we're doing here in Austin relative to other counties around the state so that you can see that. We'll look at some of the projections, and I'll bring you into some of the conversations that are happening about orders and the like in the city, still preliminary. But let's begin with the numbers as we always do. This is the main dashboard. Number of new admissions. First number we key off of is 39. That takes our 7-day moving average up to 32, and it's significantly higher than our 7-day moving average. One of the significances of 39 is that according to our color-coded risk chart, when we have a 7-day moving average of 40 or more, that's when we would expect Dr. Escott to be either moving us or talking about moving us to his recommendation of the orange coded area. Orange coded area different than the yellow coded area. Recommendation in orange is that people don't meet in groups of 10. That we limited social gatherings to none or just 2 people outside of your household unit. It minimizes the amount of time that we're outside. Very different from the behaviors that a lot of people are doing right now in the yellow area. And the reason to do that is because once these numbers start moving up, it's really hard to stop. Take a look at that chart in the middle there, the color-coded chart, and you can see where we were in yellow before as we started moving our way back from yellow into orange. And you can see the numbers down at the bottom are full months. And you can see that we went from mid-yellow up to the red zone in less than a month, just in several weeks when we started moving. So take a look at that peak that we had when we were faced with overrunning our ICUs. Look where we are right now. And you can see the numbers going up, not quite as steep as it was in July, which is good, but the numbers going up. The fear is that we're 39 new admissions. If that keeps going for another 7 days, probably wouldn't even need 7 days, we're going to find ourselves up above 40 if that number continues, which means we have to start talking then about whether we do behavior changes. The goal with this is to try to keep schools open as much as we can, which is why we have to really be stringent on everything else other than schools if we want to keep schools open. This is the analysis that's going on right now and what we're talking about. Look at the number of new cases. That's one of the first indicators. It's going to happen before admissions. We'll start seeing that number going up, and sure enough, we see the number of new cases today at 251. The 7-day moving average is 209. So you can see we're 25% above the 7-day moving average in hospitalizations. We're continuing to watch that number. We're not at a trigger point yet, but we could be moving to a trigger point. And we have to think then about 2 trigger points. What happens? What do we need to see to move into orange? And if everybody does what we need to do, and then we start coming back down, but if not, what happens next? We see cities and states all across the country now that are reaching that place before us, where their communities don't pull back, and they're having to do things that are stay-at-home kinds of orders. I don't want to try to do that. We want to try to avoid that as best we can. Let's take a look at the green numbers on the bottom of that page. The 7-day moving average, hospitalizations 175, ICU 60, and on ventilators it's 30. Let's see where we actually are tonight with respect to those 3 things. Are our numbers higher than the 7-day average or lower than the 7-day average? That'll tell you the directions that we're headed. The number of people hospitalized tonight, 196. The 7-day moving average, 175. So we are 21 people in our hospitals tonight, more than our 7-day moving average. On our ICUs, the number of people on ICUs tonight, 65, about 10% higher than the 7-day moving average of 60 tonight. Number of people on ventilators, 39. That's fully or almost a third above the 7-day moving average of 30. So you can see the concern that we have with respect to numbers that are moving up. Today's Tuesday, so we have some more numbers from Dr. Escott. Let's run through some of those numbers so you can get a general feel for where we are, and then we can talk about it a little bit more qualitatively. Dr. Escott gave us some numbers. We'll take a look at them. Here we have, that was the number of new confirmed cases. That is the case count that we have. You can see that number tracking up. The number came down right at the end. That's because he didn't have today's number when he did that chart of the 251. If that number is plugged in there, then that number, rather than the yellow line going down, the yellow line goes up at the very end. Let's look at the next chart. That was new cases. Let's look at hospitalizations, admissions, and ventilators. Those are the green numbers on those charts. The blue number is the hospitalizations. That's the one that we key off of, and you can see how that number is continuing to rise. If you look over to the right-hand side of that chart. New cases and ventilators are the numbers also going up, but obviously lower numbers, so they're not moving up in the same kind of way. Blue is inpatients. Orange is ICUs, gray is ventilators. All right, let's take a look at the next chart. The next chart we're going to take a look at is active cases by county. This is a new chart. We haven't seen this chart before, but this tells you how many cases per 100,000 people in the population, and we're looking to see how we're doing relative to other counties. If you look all the way to the right, that county that is gray, that is up at over 4,000 COVID cases per 100,000 people, is El Paso County. That's where you have so many people, they don't have room in their hospitals right now. In Austin, Texas, we have people from El Paso in our hospitals right now because we have some space. And there's no space for them in El Paso. We have people in our hospitals from El Paso that are here not with COVID, but there's just no room for them to go in with a non-COVID reason into an El Paso hospital. 4,000. Take a look at the next line down. That's the blue line. That blue line that you see there is Lubbock. Lubbock is also having a problem, not to the same extent as El Paso. But Lubbock is at about 1,500 cases per 100,000 population. If you look below that, you then see some of the other more major cities. That yellow line that is moving up, more flat, but higher than where others are. That yellow line is Harris County. The orange line and green line that are real close to each other are Dallas and Tarrant. It would make sense that their numbers would be similar because people mix up there in Tarrant and Dallas County. And then the two colors down at the bottom, the light blue line is Bexar County, San Antonio, and below that is Austin. We can feel good with the discipline we're showing that we're lower than the other cities, but not too good because we've just seen how much our numbers are going up and how quickly these numbers can get out of hand. And then the question is, what do you do about that? You know, my heart goes out to the people in El Paso that are facing situations in Austin American-Statesman today. One of the people quoted said they were getting to the place where doctors and hospitals are having to make difficult choices about who lived and who dies because they can't give the quality of service they want to give to everyone. And that is just the nightmare scenario. The local public health officials issued an order to try to keep people at home, only letting people do the essential activities. I think most people in El Paso support that in order to be able to keep people safe and avoid people dying. But that order was challenged by the Attorney General, and in a 2-to-1 vote, the Court of Appeals in El Paso sided with the Attorney General in saying that the local community could not decide what level of protection they wanted to have. The case has not gone yet to the Supreme Court. I don't know if it is or not. That Eighth Circuit opinion does not control here in Austin. But just to make you aware, if our numbers start getting really out of hand, I would imagine that the folks here locally, myself included, will want to do everything we can to try to keep everybody as safe as possible. We could easily end up in court as well. Hopefully we don't have to deal with that because our community does what we really need the community to do, and our numbers don't get out of hand. And that's what we need to be focusing on now. The more discipline we show right now, the more greater the likelihood that we can avoid what's happening right now in El Paso and Lubbock. And we could avoid even what looks like it's now happening in Harris County and in Dallas and in Tarrant County. Let's go on to the next slide. This shows us our positivity rate. Remember, we were trying to get below 3% in positivity rate. We've had gotten down to positivity of 3.3. It went up to the 3.9, 3.8, and it kind of flattened out there. And then we went up to 5.3. And then this most recent week we have data for, week 46, we're at 6.7 in positivity. I mean, that's the highest number that we have had. Each one of those green bars represents a week. It's been, 3 months? Since we had a positivity rate that was up at 6.7. Let's take a look at the next chart. This shows us what the positivity rate is broken out by ethnicity and by race. The green line that's way up there is American Indian or Alaska Native. That's gone up really high, but among a relatively small number of people. But if you look at that gray line, that's the Latino community. That number had been dropping. The last 2 weeks it was going up, and this past week, week 46, you can see that the positivity rate is over 10% in the Latino community. We've talked about that before over the last 6 months. We have a community that is disproportionately with workers doing essential services, and they can't stay home like some are able to do. Their jobs put them in risky situations. Healthcare workers, they're around people, can't stay at home. Also in communities that over generations have been denied equal access to healthcare. So there are vulnerabilities in that population that make them more vulnerable to the virus. But over 10% is a concern for all of us in this community. Not just their numbers going up, but you could see African American numbers that at one point were below the desired 3%. You can see that in week 44 are already over 5% now. The orange is other. The purple off to the right is white, and that's over 5%. We had gotten to the place at one point we were below the 3% that we were driving to get to, but in the last 4 weeks that positivity rate has gone up every week. That's the concern we have in our community right now. Let's go to the next slide. This shows us positivity by age. You can see everybody's going up, as we know we are in this community. We know that the number of folks where it's going up that are young, kind of gray, the black and the orange, number of positivity in this community above 5%, getting up to 7%, now continues to edge up, 7% up to 8%. But we also see that purple line, which is 50 to 59, now has the highest positivity rate. It's been a while since that's happened. ages 50 to 59. And you can see the pink line and kind of the aqua line to the right of that. Also going up, that's 60 to 69 and 70 to 79. When we see those numbers going up in that age group, that's when we start seeing really hospitalization numbers starting to go up. Those folks are more prone to go to the hospital. That's where we see deaths going up. The number of fatalities today, by the way, 469, which is an increase in 3 over the 466 that we had yesterday, which means today there are 3 families that are grieving the loss of a loved one. Again, as we've talked about it, 10 times as many people dying from this virus as we have dying from homicides in our city, 10 times, dwarfing that number 10 times. A more serious public safety issue in our community. Both numbers are of great concern. Let's go to the next slide. Next slide talks to us about schools. We're trying to open up. We know that Austin High was closed for 3 days today. Most people in those schools now being tested, instant tested to get people back into school. I think they're planning on Thursday. We're trying to keep our schools open. The best way to keep our schools open is to lower that positivity rate in our community generally. Everybody should be doing their part. The person that wears the mask going into the store is helping to keep our schools open. The person that is in a group outside a home, in a public area, with people outside of their home not wearing a mask, is putting at risk schools. And I don't know if they realize that they're the kind of the weak link in our chain. People not wearing masks, not social distancing, not washing their hands are the people that are putting keeping schools open at risk. And I hope they learn this or hear this so that they take better care of our community generally. Let's go to the next chart. The next chart is about flu. Let's go to the next chart after this one because I think it's the best one. Actually, there was another chart just in front of this one. I don't know if you have the one on flu that shows where we are with the flu in the city. Let's go back to the chart that you have. What this shows us is that the amount of flu that we're showing up on influenza test positive number is about between 1 and 2%. We'll show you a chart tomorrow that compares that 1 or 2% to what that number is historically over time. And you can see that in past years, the number of flu cases we had at this point in time about double what it is that we're seeing right now. And that double number as we started moving through flu season, November, December, January, February, continues to go up. And a lot of those people end up in hospitals and need hospital beds too, especially if we're seeing a spike right now or a peak maybe in another month or so with respect to COVID-19. If we're actually going to see that, we need to make sure that there's nobody in those hospital beds having the flu, which means people should be going out to get their flu vaccine right now. Everybody's waiting for a vaccine for COVID-19. We already have one for the flu. The numbers right now for the flu in the first month leading up to flu season, about half of what they've been historically, which is great news. That's probably because there are more people getting the flu vaccine now, because we've been talking about it. It also means probably with people wearing masks and other things for COVID-19, there's better protection against the flu spreading. But in any event, if you have not gotten yet a flu shot, you need to make sure you're doing that. There's that chart that we're talking about. The blue numbers in the bottom left-hand corner are this year's flu numbers. It takes us through October just into the first week in November. The other colored lines on top of that are past years. We need to keep that blue line low. While the other colored lines go up, we need to do our best as we get farther in flu season to keep that blue line low so that we're not competing for hospital beds with the flu. Janine, thanks for finding that chart. I read that fast. Thank you. All right, so Let's go on to the next chart, which is the guidelines that we have in the city. This is the risk chart. You can see in that yellow area, it's 10 to 39. That's the yellow area. We hit 39 today. But these numbers here on the left-hand side are the 7-day moving averages. Our 7-day moving average is just 32. So we're going to have to stay up that high for a few more days before we actually get to a 7-day moving average of 40. But the indications are that if we don't change our behavior, we could be hitting that and hitting that in the not too distant future. You saw how quickly we moved from yellow up to red or down to the red zone. That's what we really want to try to avoid. The numbers that we had before, 70 going into the red zone, were based on our belief that we could fill up all 340 beds that we had physically in our ICUs. What we saw in June when we started approaching higher numbers is that it wasn't the physical beds that were our limiting factor, it was the staffing that was available to us. Right now, El Paso is doing as well as they are doing, in part because they have over 1,000 staffers that have been sent to that area. We're now sending more staffers up to other big cities that are beginning to face issues. By the time this gets to us in Bexar County, I fear that there's not going to be new staff to be going around, which means we're just relying on folks we have here. I hope that's not the case, but I fear it might be. So we'll be talking to Dr. Escott and to the county judge. By the way, new county judge today, Andy Brown, got sworn in. Congratulations, Travis County Judge Brown. I look forward to continuing the great work that the county judges have done on this pandemic. This will be now judge number 3. But Judge Brown, a really smart guy. We have been visiting about this. He is up to speed and ready to take the helm there on this issue. But we're now talking about whether or not we could actually wait to get to 70 before we went into red, or now that we have to take into account the staffing issue. We probably only have capacity for about 200 people in ICUs that we can actually staff. We may have to pull that trigger down. We want to avoid that trigger, which is why everybody needs to really focus now. If you go out and you're around anybody else outside of your home and you're outside, please wear a mask, wash your hands. If you're getting together in the evenings to socialize, at this point you shouldn't be doing that. And if you're going to do it, just do it with 1 or 2 people outside of your home, and then do it just with that 1 or 2 person here for the next month or so. We have a holiday season coming up with Thanksgiving. I know there's such a need for families to get together. Try to do this virtually. Try to do this with Zoom or other kinds of things. We just cannot have families gathering that way. And as the infectivity level is going up in the community, the last thing that you want is to have a cluster in your family as a result of getting together on Thanksgiving. So I urge everybody to really pay attention. We'll talk more about the holidays tomorrow, risks in what we do next week, and the need to stay vigilant. The last thing I want to talk about here tonight is homelessness. Just to remind you that this week, 3 panels put on by the city of Austin, just to be able to talk to the community about what's our plan, what are we doing, what's all the activity, so that you can see what's happening broadly speaking in the community panel discussion. There was one yesterday. It's still online. You can watch it. But you can also watch it live tomorrow, Wednesday, and then one on Friday. Tune in Wednesday or Friday at noon on ATXN, that cable channel, or online. On Wednesday, we're going to be talking about what's happening right now, what are the programs that are in action. And then on Friday, we're going to be talking about innovations and what's on the horizon. This is a chance for the city staff to be able, and others, to explain to you what it is that's happening in the city. Because there's a lot of activity that they're doing that you just don't, you probably don't know about. But if you're going to have a conversation about homelessness in this community and what the challenges are and what we're doing, you need to be knowledgeable so that you can speak intelligently and then have a value add to the conversation. It comes from getting information and data. So I urge everybody to watch those shows. You can watch them live at noon, Wednesday and Friday. You can watch them after they have aired live on the city website, I think on the city's Facebook page as well. But austintexas.gov/homelessness-get/involved, because we need the community involved on this issue. Hey, you all take care, be safe, and let's figure out how we redouble our efforts to keep these numbers low so that we don't have to deal with going to the red zone with risk. Y'all take care.